Over the last couple of months, as I've been reporting on COVID-19 in Alberta and BC, one of the things that's become very apparent is there's a huge disconnect between the doctors and nurses on the ground, the scientific experts in places like universities, and the public health officials and governments. It's like governments and the public health officials are not connected to the reality that they are managing. So a new group has been formed called POP Alberta, and it's a group of healthcare professionals, doctors and nurses, and so on. And I'm going to talk to Dr. Joe Vipond from Calgary. He's an ER doc about that. So welcome to the interview, Joe.
Thanks for having me on.
Well, I hope I described it accurately. The disconnect, you're organizing because you're just not, the government and the public health, like Dr. Deena Hinshaw, just aren't managing properly. I got it right?
Yeah, I mean, we originally started in response to the cancellation of testing, tracing, and isolation, and actually to do some on-the-ground protests. And after the success of that, when there was this absence of government, this vacuum of information, because Dr. Hinshaw wasn't speaking publicly, Kenny was missing, Chandra was missing, we said, well, you know, people want to know how to protect themselves. People want to know how to be safe. So let's provide that information. And so just a slight nuance to your description of us, we're not just doctors. In fact, we have scientists like Gojia Gasparovitz and Connor Ruzicki, who are really very well respected in their fields, and political scientists like Lorian Hardcastle. And then we have some really committed activist citizens who just wanted to make a difference themselves. And they're another key component of our group.
Right. And I think that's a really good point in the fact that the government and Dr. Hinshaw weren't providing the information. And here's where I come from this, Joe. I've got family. I've got kids and grandkids in Calgary and many friends in Alberta. And the thing that comes over and over again in conversations with them is we don't have enough information to do our own personal risk assessment. How risky is it? We don't know. We don't have the data. We don't trust the government. We don't trust Dr. Hinshaw. Is that a fair comment?
Well, I mean, you've had some interviews where you've talked about the fact that COVID is airborne, and that our government officials, including at AHS, have been very reticent to say that out loud. You really need to say that out loud, because unless you understand the underpinnings of how the virus works, it's very hard to make good policy. So, for example, if you just focus on contact droplet, you're focused on 2-meter distancing and hand washing and maybe some masking, but only if you're in proximity to others. If it's airborne, then hand washing doesn't really matter. You still should be doing it. It's good practice. But masking should be everywhere indoors. Ventilation becomes important. Filtration becomes important. It just opens up better avenues, better mitigation avenues. And so that's why that's one of the things we've been focused on. The other thing that we've been hearing from the government, which is kind of as a blatant mistruth, is that schools don't transmit COVID. They're just representative of community spread. And I think as you're seeing in Alberta with the 5 to 11 age just skyrocketing, they're the #1 group now in this province. Schools are where the infections gather and get shared, and then it goes into households, and then it goes from the households into the community. So it's really the exact opposite to what we're being told. And so it's our hope that by presenting these truths, we can override some of the mistruths that we're hearing from government officials.
There's a question I have, Joe, that hasn't been answered yet. When I interview experts, both BC and Alberta, and then across the country and into the US about this, there's a huge disconnect between what the public health officials are sort of believe. It's like they're a generation behind that what's really going on with the science and with the practice on the ground. Have you got any explanation for why that is?
Yeah, it's in some ways, it's the whole reason why Masks for Canada and Protect Our Province, Alberta exists, is to try and provide timely evidence. The airborne one is very challenging because we knew this early on in the pandemic, and it's just been resistance after resistance. In fact, the Public Health Agency of Canada has some excellent evidence reviews that they've kept kind of locked up, hidden. You have to really go hunting for them in order to find them. And it's really inexplicable to me why that's not being shared out there, not being talked about openly. So I'm not sure. I mean, those would be good questions for, hopefully you can get some of those people on your show and ask them why this resistance. But it may have something to do with, this sunk cost fallacy. If we've already, said that this is what it is, it's really hard to withdraw that. We can walk back the talk. And I'm sure there's hubris and egos and other aspects too. It's certainly not science, because the science is strong.
Well, Joe, final question. We've heard over the last week or so, maybe longer, that the Alberta healthcare system, the hospital system, is essentially collapsing. I mean, everybody who's watching this probably knows already about, patients being flown to other provinces, that sort of thing, canceled surgeries. But you're an ER doc. What do you see on a daily basis? Tell us about your personal experience.
Well, I would just say right now, the Emerge is working very well. We still see people, we see COVID people, we see heart attacks, we see broken bones. It's still functioning well in the urban settings. I've heard maybe a little bit different about rural settings, where they are really overwhelmed. They obviously don't have the resources that urban areas have. The most worrisome thing, I would say, and something that people need to note, is that we're seeing the same phenomenon now as we did in April and May 2020, where we had a slowdown in our Emerge visits. And that resulted in a lot of preventable illness and death, because people with crushing chest pain were staying at home because they didn't want to bother the healthcare system, or stroke symptoms, and they were worried about coming into the hospitals because there's COVID there. So we know that that's kind of like this hidden wave of disease. And I would encourage viewers that if you're experiencing problems that need an emergency room, you probably should be in the emergency room, because that's why we exist. Don't push off to tomorrow what needs to be dealt with today.
How does that square with the frequent comments we've seen about Alberta being very close to enacting triage protocols?
Well, the Emerge is an all comers. We're used to just whoever comes in the door, we'll take care of, and we have good Emerge staff and good nursing staff. Our numbers are adequate. The triage protocols is because especially the intensive care units are completely overwhelmed. We're well beyond normal capacity and approaching even our surge capacity, and it's not just that for an ICU patient, you need a location, a bed, and equipment, and healthcare workers. And I think the first set we have, it's the healthcare workers that we're limited by. This is really specialized work, and you can't just throw anybody to be a bedside ICU nurse or an intensivist physician. And so those are really the limiting factors. And that's why when the call out to the feds came on Tuesday from our government, that was one of the things that they highlighted that we needed is more trained bodies.
So it's not the ER itself, it's the ICUs that are really the crisis at this point.
Right. We're still functional. We're still working. We take all comers. If you're sick, you need to be in the Emerge. Please come.
Joe, thank you very much for your insights. Always appreciated.
Thank you, sir.